Yeah.
Good afternoon, everybody. Good afternoon, everybody. I'm Mrs. Lakshmi, clinical nutritionist and registered dietitian from Kamineni Hospital, Nagar. Today, just because of the this summer season, we would like to discuss about the dehydration and how to rehydrate. So there are few things like just will go through what are the different conditions which causes dehydration. There are certain conditions we'll be knowing it like different causes like gastroenteritis and other causes can dehydrate, sunstroke and severe diarrhea. These are the some of the causes for severe dehydration. Okay. So we all know that thirds of our body is made up of water. Any small difference in the variation in the body fluids will be knowing like certain symptoms like dry mouth and yellow colored urine and thirst and dry skin and will be having headache, and few people have muscle cramps, fatigue, and hypotension as well, and constipation. So these sort of signs will manifest it, and we should know how to like how much to take, what to take, and what are the different options for it. Just we will discuss about those things. And usually the diarrhea uh, or vomitings or diarrhea or fever. In a mild cases, only one anything like vomitings or fever or can handle easily. But in severe cases like diarrhea, it causes severe dehydration. So in that cases, these there are types like mild, moderate to severe dehydration can happen, and these mild cases we can easily handle. The guideline says that within 45 minutes of dehydration, if we take 600 ml of water, it can be reversible. So everybody, whatever, like if you feel that we are dehydrated, then immediately we should start sipping of water. So then we can control it. And certain like we can see simple conditions to complicated conditions as well. In clinical scenario, we see a lot of cases like diabetes insipidus and IBD cases, Crohn's, and a few people on diuretics. It can cause dehydration. So, and even some of the like antibiotics also induces diarrhea. So, when all these conditions, we have to take certain like liquids, and so that even in clinical scenario, even doctors will give IV fluids, and even the oral liquids we have to give so that patient will recover faster. And we see many cases immediately after taking oral liquids, the dehydration can be reversible within 1 or 2 days. And we will see age-wise recommendations. Like pediatric cases, they're very vulnerable and they dehydrate very easily, like hot summer periods and all. So we should take very much precautions to be taken, not to exposed to like dehydrated conditions, or very much like we should take care of the very carefully. And even geriatric population, and this for the geriatric population, they have a decreased thirst sensation. That's why some of the people doesn't know. So in geriatric population also, day to day monitoring is very much important. And like how much to give, what to give, it totally depends on their condition. Few people will have certain disease conditions where like fluid overload conditions, and all those conditions we have to see how much to give, what to give, and particular disease conditions which is suitable for them. And even in pregnancy, additionally 800 ml of water extra should be taken. And lactating people also at least 1.5 liter extra for the sake of breastfeeding should be given. And in the clinical conditions, generally dehydration means people say take lot of liquids. Liquids means generally we observe like liquids means many people take juices only. It is not so. Liquids means any liquids. Liquids starting from this thing like any preparations that is like in a liquid form can be, there are many other options. Many other options like clear liquids, when severe like vomitings and all we will give, we provide clear liquids like coconut water, even the rice water, barley water, everything it can be given. So whether to check whether they are tolerating or not. If they are tolerating clear liquids and all, then we will give a full liquid then to combination of solvent and liquids and all. But these options we should limit to sugar products like juices and all should be limited. Why? Because it actually sometimes it causes more harm as well. So all the coconut water, juices, like anything sugary products, restriction should be a must. Like at least one glass of any sugary products, and other choices should be of like buttermilk, any water, or porridges sort of thing like sago, ragi, or cereal porridges, or a better combination. In hospital scenario, we give like that a combination of juices, combination of soups, cereal porridges, and buttermilk, all those sort of things, like a combination, it works better. And we had seen lot of results with it, because in certain conditions where we asked the people like what all they had taken, juices, coconut water, like they land up in hyperkalemia. So, not to, a combination of like always advisable only 1 or 2 glasses of juices or coconut water, and other things cereal porridges are better for better management of this dehydration. Okay, so then coming to the clinical conditions, we as a dietitians, we give the choices based on the disease conditions. Suppose they are diabetic, what ought to be taken? If the patient is a sick kidney patient, what ought to be taken? And some of the patients like a liver problem, even with dehydration. So what all to be given to them? It's totally a dietitian, like a customized plan. So everything we should look into to the patient's, suppose in a kidney problem, what is the urine output? Accordingly, how much to be given in a calorie dense way, and with the choices of the patients. That is actually we do. And uh, the other things like porridges, all other things gives little bit of calories as well. People get energy little bit. So always juices, coconut water, soups, porridges, at least 1 or 2 times gives a better hydration, and they recover very fast. And we all see that cause. What is the cause? Mostly water contamination can cause the dehydration. So safe water, it is very important to drink a safe water in a like always from a safe origin, and safe food as well. And safe food, it also helps us not to have any like any food, contaminated food also causes diarrhea. So safe food and safe water helps. And as a water, we know that it has lot of preventive role as well. So once dehydrated, again it takes little time to come back to normal. So in normal life, we are supposed to take at least 2 liters of water for a healthy person, or if any UTI infections or hyperuricemia or renal stones, extra little bit of half to 1 liter extra to be taken depending on the condition. And actually in clinical condition, in severe diarrhea, both doctors will manage with IV fluids and we give oral fluids. And nowadays, like even packed food, like whatever it is, like uh, the sterile form in a anything, we always prefer porridges. Why? Because porridges are sterile. They bring to the boiling point. So even then if we give, it will not again contaminate. So the main difference between giving anything like sterile form helps the patient to come back to normal condition. That's why, and in between, if the person tolerates well, then we can progress to the very much easily digested food, whatever it is, whatever the person takes, and then can progress. So initially, 1 or 2 days are very important, and we should yeah, take care so that they will come back to normal very easily. Risk factors are contaminated water, contaminated food, and exposure to sunlight, and even some of them will have those who are on diuretics, and those who have not, those who don't take enough water as well, they are at risk of dehydration. So it is how is dehydration treated? So the dehydration is treated by giving lot of at least we should take 2 liters of water daily, and if dehydrated extra 1 liter depending on the condition. And we should see the main thing is, uh, in elders case we have to see the how is the urine output, then we have to see how much to be given. For normal beings, it is like 2 liters, 2 to 3 liters should be given. Preventive aspect, 2 liters extra when dehydrated. Symptoms of dehydration in adults and children, and they become first weak, and thirst, dried mouth, and thing is they will have yellow color urine, and elders they'll have less urine, and very they will have headache, and they will have hypotension, weakness, everything. This warning signs of dehydration in toddlers. Yeah, it is in toddlers or like any babies. The warning signs, like they will. We should see like how their diapers and how they are urinating. If it is very much thick yellow color, we can see that they are dehydrated. In case of pediatric people, immediately should be taken to the doctor. We should not delay. We should not delay. Immediately should be taken. And possible complications like and sometimes if we delay that, it is like fatal sometimes, so immediately we should consult a doctor in case of severe dehydration. We should watch whether it is progressing or not. If it is it is becoming severe, immediately we should consult a doctor. Yeah. In infants, how to treat dehydration in infants? In infants, breastfeed babies, we need not give water separately, but mother should take more water for breastfeed babies. And we can stay healthy. It is especially important in during summers.